Welcome to LPN LaunchPad's presentation on sensory and reflex assessments. This presentation focuses on the methodologies and clinical implications involved in evaluating sensory function in patients. Sensory function assessment evaluates a patient's ability to perceive stimuli such as touch, pain, and vibration, and identifies potential nerve damage and neurological disorders. A systematic approach guides the evaluation of sensory function. When assessing the head and face, the clinician applies a cotton ball to the forehead, cheeks, and chin to test light touch. The nurse evaluates the pain sensation by comparing the patient's response to sharp versus dull stimuli. The nurse also assesses the temperature sensation by asking the patient to differentiate between warm and cold objects. Observe how these simple tests yield valuable diagnostic information. For the upper extremities, the clinician tests light touch on the arms and hands using a cotton ball and evaluates pain sensation by requiring the patient to discriminate between sharp and dull stimuli. The nurse measures vibration sense by applying a tuning fork to the wrist. The clinician assesses proprioception by moving the patient's finger up or down while the patient closes their eyes. Reflect on how these evaluations contribute to a comprehensive sensory profile. In the lower extremities, the clinician applies a cotton ball to the legs and feet to assess light touch, compares responses to sharp and dull objects to test pain sensation, and uses a tuning fork on the ankle bone to evaluate vibration sense. The nurse assesses proprioception by moving the patient's toe up or down while the patient closes their eyes. Notice how these tests help reveal localized sensory deficits. Normal sensory function is present when the patient accurately identifies all applied stimuli. In contrast, abnormal sensory function appears as numbness, tingling, or a complete loss of sensation. Peripheral neuropathy frequently results in vibration, pain, and temperature perception deficits. Keep these distinctions in mind, as they are critical for accurate diagnosis. Reflex testing assesses the integrity of the nervous system by directly stimulating reflex responses. It differentiates upper from lower motor neuron dysfunction and detects spinal cord and peripheral nerve injuries. Consider the pivotal role of reflex testing in forming a complete neurological assessment. The clinician tests the biceps reflex in the upper extremities by tapping the tendon in the antecubital fossa, which produces elbow flexion, and assesses the C5 to C6 nerve roots. To evaluate the triceps reflex, tap above the elbow to elicit elbow extension and assess the C7-C8 nerve roots. Assessing the brachioradialis reflex by tapping the forearm to generate wrist flexion and supination and evaluating C5-C6. Observe how each reflex response provides insight into neurological function. The nurse evaluates the patellar reflex for the lower extremities by tapping below the kneecap to induce knee extension, which tests the L2 to L4 nerve roots. The nurse taps the Achilles tendon to assess the Achilles reflex to produce foot plantar flexion, which evaluates the S1 to S2 nerve roots. These reflexes yield critical information regarding the integrity of the nervous system. Nurses apply a standardized reflex grading scale. 0 indicates no reflex, 1 plus indicates a diminished reflex, 2 plus indicates a normal reflex, 3 plus indicates a brisk reflex, and 4 plus indicates a hyperactive reflex with clonus. This scale standardizes the documentation of reflex responses, ensuring consistency across clinical evaluations. When assessing Babinski's sign, the clinician strokes the lateral sole. A typical response produces a downward curl of the toes, whereas an abnormal response, in which the toes fan outward, indicates an upper motor neuron lesion. Recognize Babinski's sign as a valuable indicator of central nervous system integrity. For NCLEX preparation, review the sensory deficits associated with conditions such as neuropathy, stroke, and spinal cord injuries. Recognize that loss of pain, temperature, and vibration perception is a key diagnostic indicator. Consider how these sensory findings inform patient management and diagnosis. Prepare for the NCLEX by mastering the reflex grading scale from 0 to 4 plus. Recall that Babinski's sign is abnormal in adults and that alterations in reflex responses signal potential spinal cord damage. These tips are essential for enhancing clinical reasoning and exam performance. Consider the following question. A nurse assesses a patient with suspected peripheral neuropathy. Which finding is expected? Option A, hyperreflexia. Option B, decreased vibration sensation in the feet. Option C, a brisk plantar reflex response. Or Option D, intact pain and temperature sensation. Reflect on the clinical presentation of peripheral neuropathy as you consider your answer. The correct answer is Option B, decreased vibration sensation in the feet. Conditions such as diabetes often result in peripheral neuropathy, leading to decreased vibration perception in the extremities. This question emphasizes the importance of sensory evaluation in diagnosing neuropathy. Next, consider this question. A patient presents with a positive Babinski's sign. What does this finding indicate? Option A, a normal response in adults. Option B, a lower motor neuron lesion. Option C, an upper motor neuron lesion. Or Option D, peripheral neuropathy. Think about the implications of Babinski's sign for neurological integrity. The correct answer is Option C, an upper motor neuron lesion. Babinski's sign is abnormal in adults and signifies damage to the central nervous system, as seen in conditions such as stroke or multiple sclerosis. This reinforces the diagnostic value of reflex testing in clinical practice. Now consider another question. A nurse assesses a patient's ability to differentiate between sharp and dull sensations. Which sensory pathway does the test primarily evaluate? Option A, the corticospinal tract. Option B, the spinothalamic tract. Option C, the dorsal column medial lemniscus pathway. Or Option D, the vestibulospinal tract. Focus on which pathway transmits pain and temperature information to the brain. The correct answer is Option B, the spinothalamic tract. The spinothalamic tract carries pain, temperature, and crude touch sensations to the brain. In contrast, the corticospinal tract controls voluntary motor movements. The dorsal column medial lemniscus pathway transmits vibration, proprioception, and delicate touch, and the vestibulospinal tract contributes to balance and postural control rather than primary sensory processing. Hey there, this is Brian. I am the creator of LPN LaunchPad. I want to say thank you for learning with us. In addition to these videos, I've created a series of free adaptive quizzes in ChatGPT. The link to this video's quiz will be listed in the description below. Help me keep this project alive by hitting the like and subscribe buttons.